So our next topic is fibromyalgia. Fibromyalgia is a medical condition characterized by a widespread pain in the muscle and bones which accompanied by fatigue, sleep, memory, and mood issues. Pain in all four quadrants of the body and the presence of a specific tender point. Most people who suffer from fibromyalgia are women. Fibromyalgia is a long-term disorder and is due to the abnormalities in how the central nervous system processes pain signal. In 1990, the American College of Rheumatology developed classification criteria to help guide clinicians in the diagnosis of fibromyalgia. This criteria is meant to be a guide and not a definitive diagnostic criteria. In fact, 50% of patients may not fully meet this classification criteria. The ACR criteria for fibromyalgia includes the history of widespread pain in all four quadrants of the body and the eggshell skeleton, and a physical examination with 11 out of 18 tender points. The tender point is defined as pain experienced when 4 kg of pressure is applied to skin or enough pressure to blanch the examiner's nail. The remainder physical exam is fibromyalgia is usually unremarkable. Fibromyalgia is challenging because people often have pain and discrete tender points and widespread pain at the same time. The following are the examples of a tender point. First, occiput, or it is located at the suboccipital muscle insertion. Next is the trapezius. It's located at the midpoint of the upper border. Next is the supraspinatus, located at the above the medial border of the scapular. Next is the gluteal, located at the upper outer quadrants of the buttocks. Next is greater trochanter, located at the posterior to the trochanteric prominence. Next is low cervical, located at the anterior aspect of the intertransverse spaces at C5 to C7. Second rib, or located at the second costochondral junction. Lastly is the lateral epicondyle, or 2 cm distal to the epicondyle. People with fibromyalgia have a heightened sense of pain, sometimes described as muscle ache. The condition is not a progressive disorder, meaning it won't steadily worsen over time. Many people who suffer from fibromyalgia also have a irritable bowel sound, anxiety, tension, headaches, depression, and according to the National Fibromyalgia Association, the disorder affects about 3% to 6% of the world's population. Causes. The exact cause of the fibromyalgia is unknown. Researchers are close to understanding factors that may work together to cause it. Researchers believe that the condition is related to an abnormal increase in levels of certain chemicals in the brain that signal pain. This changes the way in which the central nervous system processes pain messages transmitted around the body. In many cases, the condition is triggered by a variety of factors working together. This may include infection, genetics, physical or emotional trauma, such as repetitive injury in the body caused by performing the same action over and over again, death of loved ones, breakdown of relationship, car accidents, or a person suffering from osteoporosis or rheumatoid arthritis or lupus may be more likely to develop fibromyalgia. The pathogenesis of a fibromyalgia remains uncertain and somewhat uncontroversial. There's some evidence for a genetic predisposition for fibromyalgia, since first-degree relatives of fibromyalgia patients have 8 times more likely to develop fibromyalgia as well. Also, there has been some investigation into the possible polymorphism in serotonin 5-HT2A receptor, serotonin transmitter, dopamine 4 receptor, catecholamine or methyltransferase enzyme as involved in the pathogenesis of a fibromyalgia. Environmental factors such as physical trauma, infections, hepatitis C virus, Epstein-Barr virus, parvovirus, Lyme disease, emotional stress, regional pain condition, autoimmune disorder have all been postulated to play a role in a fibromyalgia. Other theories are focused on abnormalities in pain and sensory processing, or by some yet to be determined mechanism. The threshold for detection of pain much lower, unclear in etiology. Alternatively, augmented central pain processing may play a role as well. We know that elevated substance P has been found in the CSF of fibromyalgia patients. Substance P is a part of susceptible and has been identified as being elevated in the CSF fluid in many chronic pain disorders. A decrease in descending antinociceptive pathways and alteration in hypothalamic pituitary and autonomic dysfunction, in addition to psychological and behavioral factors, have been theorized as possible pathogenic mechanism for fibromyalgia. Symptoms: increased sensitivity of pain, fatigue, widespread pain occurring in both sides of the body and above and below the waist, difficulty sleeping, headaches, muscle stiffness, fibrophagia, or it is a problem with memory and concentration, irritable bowel syndrome, restless leg syndrome, tingling and numbness in feet and hands, sensitivity of cold or heat, and sensitivity to noise or lights. Diagnosis: there is no single test that can fully diagnose fibromyalgia. A diagnosis can be made if a person has experienced widespread pain for 3 months or longer with no identifiable underlying medical condition related to the pain. Other conditions with similar symptoms may be ruled out by blood tests. Blood tests may include CBC, rheumatoid function, thyroid function tests, and erythrocyte sedimentation rate. Treatment: although there is presently no cure for the disorder, treatment options are available to help relieve symptoms and make the condition easier to live with. Medication can help relieve pain and improve sleep, such as antidepressant, duloxetine, and milnacipran. Over-the-counter pain relievers, acetaminophen and ibuprofen, anti-seizure drugs such as pregabalin. Variety of therapies can reduce symptoms associated with the disorder, such as physical therapy that may include exercises to improve strength, flexibility, and stamina. These therapies have been linked to a reduction in pain, tenderness, and sleep disturbances in patients. Mind-body therapy that focuses on interaction among the brain, mind, body, and behavior. This may include yoga, tai chi, mindfulness, or cognitive behavioral therapy. Now, what are the nursing diagnoses of a fibromyalgia? First, impaired physical mobility related to discomfort and pain as evidenced by limited range of motion and reluctance to attempt movement. Next is chronic pain related to compression of nerve endings as evidenced by guarding behavior and autonomic response. The nursing intervention is as follows. Monitor the patient's sensory disturbances and level of pain. Monitor for any adverse reactions to the medication given. Exercise can be helpful in maintaining muscle and conditioning, improving energy, and possibly improving sleep quality. Teach the patient how to do stretches safely and effectively and encourage her to perform them regularly. Encourage the patient not to stop exercising altogether because even a little limited amount of exercise each day may be beneficial. A bedtime dose of tricyclic antidepressant can cause morning drowsiness in some patients. Sometimes taking the dose 1 to 2 hours before bedtime can improve sleep benefits while reducing these morning after effects. A daily stretching program can help preserve range of motion in the neck, shoulders, and hips. Administer medications as ordered and monitor for the effects. provide emotional support to the patient and the family. The prognosis or outlook of fibromyalgia. Most people who have fibromyalgia can ease symptoms with medications and lifestyle changes. Sometimes symptoms go away after the patient takes steps to reduce stress, but symptoms may return during stressful times. A small number of people experience pain or fatigue so severe that they are unable to do their work or activity of daily living. Thank you for watching and listening.